Good morning, everyone. It is April 21st for today's press briefing. I have John Woodrich, CEO of Bryan Medical Center, with us. Tomorrow we are going to bring you some information on the mobile screening unit. Brad put up a message on the WebEx that there will be B-roll and stills provided for that tomorrow, and we will also have Dr. Ina Silenex, a pathologist here in town, talking about convalescent plasma. Real quickly, before we get to the stats, there's been a lot of questions submitted, circling around both supplies and elective procedures, so we're going to cover a few things here that might answer some of those general questions, and then obviously we anticipate some questions for John on that as well. So when we start with supplies, there was some reference in the national media about we have enough supplies, and some of the community members asked us about this through Facebook Live. So I want to break it down. When we're talking about supplies, we're talking about supplies to test, supplies to treat COVID-19 patients, and then supplies needed to restart elective surgeries. So as we talk about personal protective equipment, we've covered in the past we had some emergency stockpiles, and then we had monthly orders, and then there was some access, hopefully, to national and state emergency supplies. As you recall, the suppliers basically began rationing, so we were restricted to ordering 4,040 gowns at a typical, or each week, when our normal usage was 1,400 a day. Usage demand obviously spiked with the intake of patients, and as we shared in the past, that for one COVID patient in an isolation room, you can go through up to 150 gowns per day. So it's that wonderful generosity from the community really helped bridge a gap for us, and it wasn't because Bryan couldn't afford to buy gowns, it was because there were simply none available. Supply chains are relaxing a smidge. When we talk about testing supplies, you've been tracking this along with us the whole way. There were testing constraints both at Bryan Medical Center, our walk-up clinic, and our drive-through clinic. And it was around the kits and the reagents and the swabs. That's why opening our lab was such a big deal, not necessarily for the supplies, but to take some of that stress off of our reliance on the commercial and state lab. So we do still have a limited supply of those cassettes and reagents, and we are preserving those, as you've heard, for those with the most high probability of being positive for COVID or requiring a test, and it still does require a physician order. So I know that was one of the questions that came in. As far as elective surgeries, as you recall, we suspended on March 25th, which was prior to the governor's order. The order that the governor put in was extraordinarily important because it opened up channels of funding through the feds. So John shared a little bit yesterday about our plan to restart, and then obviously some of the questions that have been circulating. The governor's statement yesterday to restart in early May has created a buzz. I think PPE and the availability of those supplies, blood, will factor into it. But the most important decision at Bryan, we will reopen for elective procedures when it is safe for our patients, our staff, and our physicians. And John is involved with many meetings where there's coordination between St. Elizabeth's and Lincoln Surgical Hospital and the Department of Health on that. So that was a lot of ground to cover on both supplies and PPE and elective surgeries. I know there will be additional questions, but that should have covered some of the advanced questions that came in. Our daily census is 347, and if you recall, Bryan is licensed for 640 beds. Our screening visit questionnaires, we hit a milestone there. We have crossed 10,000 Bryan Easy Visit questionnaires completed at 10,127, resulting in 3,045 easy visits. And the COVID promo code was used by 1,413 people. A few other milestones, I think some good, some not great. We have now tested 2,001 patients at Bryan, with 101 resulting in positive COVID-19 diagnosis. Negative, we have 1,791 so far, and right now we have 109 pending. So I'm going to call John up to talk about our mobile screening plans for electives and any of your questions.
Thanks, Bob. I'm John Woodrich, CEO of Bryan Medical Center. And Bob, thanks for that update. I think you covered a lot of questions that people have had on their mind. Just to give you an update on our in-house COVID patients positive, we have 6. 1 is from Lancaster County, 5 from outside the county. We have 8 people pending results. 5 are Lancaster residents. 3 are from outside of Lancaster County. We have 6 people in our ICU, 3 in our progressive care unit, and 5 in our general care unit, and 4 individuals that are on ventilators. So I think we've had a number of questions on the elective surgeries. We will continue to work with our doctors. We will prioritize which patients need to come in first. We're looking at trying to figure out, do we open up 50%, 75%? What we don't want to do is open up, run out of PPE, or run out of blood. So we're going to have a systematic approach to addressing the issue. With that, I wanted to take some additional questions, but comment on our mobile unit. We're working on that right now. We're going to be demoing it at some other locations just to make sure we get connectivity. So we'll have hotspots so that no matter what area we move into, we want to make sure that we can communicate, that we can see patient information, send that information back appropriately. So there's a lot of just trial that we're going to go through in the next few days so that when we're called to service areas, we can. I think we mentioned yesterday that one of the areas that we're going to focus on is Crete. So we'll be looking at our Crete Area Medical Center to see if we could mobilize that unit in that parking lot, or we may look at just any area within Crete that gives people access to that screening tool or that mobile unit. We do understand that some people have difficulty for transportation. We also understand that there's going to be language barriers. We're working with the health department. They're going to provide translators for us as well, and we have some within the Bryan system here. But we're trying to make sure, because I think that's always the question that people have. Are you testing enough? Are you testing in the right locations? Is our numbers showing truly what's existing in our community? And we just want to assure that we're basically covering our community because that's who we support. We support all of Nebraska. We want to make sure that those smaller rural areas have access like we have in the city of Lincoln. So with that, we'll take some additional questions that people may have. We want to work with the National Guard and assure that we're getting the testing done appropriately. At least what we're reading about right now is that when they mobilize, I believe on Thursday, they will have 100 tests available. I think that'll give, a relatively good sample, but we want to make sure that we're supporting that community as well. So if we can do additional testing and get a bigger sample to identify if we have an outbreak in any specific area, that we could address that as soon as possible before it becomes more widespread. I think we've learned a lot from what we've seen from different areas of our state and different areas of the country, that if we can head it off a little sooner, that's what we prefer to do. And when we've seen some positives come from those areas, we want to make sure that we're there to support those individuals. I think we saw 73 individuals yesterday, and I should share with you typically what happens. So we have people utilizing the Easy Visit screening, and they're sent to the drive-through. But then our private physician offices also send individuals to that drive-through. And typically what you see is, because most practices aren't open on Sunday, if people visit their physicians in the morning, those will hit on Monday. But now from the other individuals that may have seen their doctors on Monday afternoon, those are scheduled for Tuesday, and we see the numbers get higher on Tuesday, Wednesday, Thursday, and Friday. They taper down a little bit on Saturday as well. I believe we probably will hit that May the 4th date, but as to what level that we will start, Do we want to go up to a 50% capacity of what we had before? But I think more importantly, we have to work with our physicians, because I'm sure that there are priorities in regards to which patients probably need to get in that have been delayed for a period of time, and we want to make sure we're doing what's best for our patients and that we listen to our physicians and coordinate care with them as to how many surgeries we'll start out with doing. We're doing projections right now on how much PPE we will utilize, but just remember, it's not like looking back to the way it was before COVID, because now I think you're watching where we're masking everybody that's coming in, so every one of those patients. So there will be more utilization of that type of equipment, as well as our staff in working with individuals, because all of these people coming in won't have had a COVID test. So we even have to look at that scenario. Is there anybody that's at risk that we should be doing that type of test prior to them having surgery? I think it'll have an impact without a doubt, but I believe it will be some period of time till you get up to 100%. I think the thing that we don't want to do in this community is open up elective surgeries and try to go 100% and then find out we're burning through all of this equipment, that then we have to shut it down again. I just don't believe that's good management or leadership for this community. So we're going to be very careful on how we do this, but also take into consideration what is best for the patient and which ones need those surgeries done sooner than later.